Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. Welcome to the Kaur Show. I'm Ranjeet Kaur from the UK, and here is my co-host Gurinder Kaur from Australia. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. Benji, how are you?
Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. I'm doing well and hope same for you.
Yes, I'm great, thank you. So today's topic is about mental health in the new normal. And so we have two special guests today who will be joining us later to provide their input on this topic as well. And so we're just going to give our opinions on this topic beforehand. And Sangatji, if you are logged in and here, please give us some comments, some questions, so that we can also discuss this together. And that would be great too. So in my opinion, life with obviously mental health in the new norm, life is not the same as it used to be. So, Benji, what is your opinion on this, on what's happening with the mental health in the new normal?
That's right. I think one unique situation at this moment of COVID-19, especially, I think this word has become very common in our households, be it parents, be it children. And there is one specific reason that we are all in this together. And it's affecting everyone, and of all the nationalities, all races, people of any language, any color. So we are traveling in this boat all together. And one of the stresses that we have to mind is the mental health. It's impacting mental health of all ages. So it's very important that we do look after the mental health and we talk about it. So I think that's the reason that we have got this episode, especially for everyone today. Even though coronavirus is a talk of every household, there are most people who are actually impacted, but they're not coming out. So I think we need to bring and talk about this topic.
Yeah, it's definitely not the same as it used to be. There could be like a feeling of uncertainty, financial strain for some people, which could affect their physical and mental well-being as well. And also, I feel like with children, they could be affected as they're not seeing their peers and they're not able to engage with their normal activities. A lot of the families are housebound and they're finding it difficult. Children are finding it difficult to understand this situation. I mean, with my children, the common question I get asked is, when will this coronavirus go away? And so, Benji, do you also face these type of issues as well at home, or?
Certainly, yes, I do. And especially in Australia, in Victoria, we do have school holidays, which are starting from tomorrow. And, it's very different. The new normal is going to be very different. Kids are going to ask us, okay, what we're going to do in these school holidays. And we have to come with all these adventures now in the household. There is a restriction of like 5 people in the house. It's very hard to go out and, do all the activities that we used to do in the past. So the new normal is very different and it's a challenge for us.
Yes.
And had you ever thought in the past that the toilet tissue papers will be like gold? It's so much different now, the situation. It's selling like gold and people are, the shelves are empty. The shopping, which used to be a normal activity, now it's like an adventure. You pre-plan and do a lot of stuff. And, whether we are going with this family, whether you're going alone, it's very different from what it used to be in the past.
Yeah. Shopping yesterday was horrendous. I think we waited half an hour in the queues just to go to one shop. And we gave up after a while. We couldn't do it. And online's a better option, I think, at the moment. But yeah, it's definitely not the same. Yeah, definitely not the same. So it would be great to have our hosts on so that we could, the guests, so we can talk to them about how all this has affected us with the new change now and how mentally it's affected a lot of people in public health after this disaster, obviously.
Yeah, that's right. So we've got 2 wonderful guests with us today, and we have got Nikki Simos, who is from Mind Ahead Australia, and she's wearing a couple of hats, I'll say, and I will get her to introduce once she is online with us on the screen. And a second guest is Ravinder Kaur, and she's an active community member from Melbourne, and I'm pretty sure most of the people know her. So I think let's welcome them. So welcome, Nikki and Ravinder.
Good evening, ladies. Thank you for having us on the show this evening.
You're welcome.
So, welcome to the Kaur Show. And as you must have heard our discussion so far, that the topic of today is mental health in the new normal.
Mm.
So, we might start with Nikki. Benji, you want to start your?
Yeah, so
Nikki.
welcome, Nikki, to the show.
Thank
And
you.
so what I wanted to ask you is, what is your thoughts on the new normal with people and how their mental state of mind is? And what's your thoughts on this?
Mm. Okay, so it's a very broad question, and there's probably three in that whole one, but we'll certainly give you the best option here to give a good snapshot. I just want to rewind a little bit, if that's okay, and that I do need to, and you probably know the statistics, that in our normal mental health capacity or non-normal capacity of mental health, there is 1 to 5 Australians who will actually suffer some sort of mental disorder. And that's in Australia. And I imagine overseas the statistics may be equal, if not higher. There's about 45% that will actually experience a mental health condition. And the concern with that is obviously 75% of those who are suffering mental health will have problems, unfortunately, under the age of 25. Now, that doesn't necessarily mean that people over 25 are not currently experiencing that, because that is what the new norm is. So, and part of, unfortunately. So when we talk about what was once a mental health condition, it seems to have progressed to what was, currently is, and even more so moving into this new normal. So the new normal, in my opinion, is certainly very different to what we've all known to be in the past, which you touched on at the beginning of your discussion and opening statement. We do need to conform to what that could possibly look like for individuals within their own environment. And also, I think it's very important to be very aware that the day-to-day business that you would have, you know, waking up the children to go to school if there are children in the home, the seniors in the home, if you live with seniors in your home, and what that would look like in your environment, and managing the children's day-to-day task. I mean, we had the stage 1 restrictions where there was a complete shutdown and everybody was to stay at home, and that obviously affected, you know, the grandparents, the children, the working parents, all in one hit. And so that was stage 1 of understanding what that would look like. And for the beginning, the kids, if we're talking about children, week 1 was like a holiday. I love this. I'm at home. I get to see my parents. I get to see my grandparents. I get to do some activities at home with my family, perhaps where I wouldn't normally have time previous to COVID-19. But then, of course, you've got the other side of that, which is the working parent who is at home, who does need to do their day-to-day task, does need to be the mother hat, and then the parent, and then the wife, and then support perhaps seniors in their family, and of course the children with homework or questions that would be popping up left, right and centre. So all of that is actually complete overwhelm in the transition from what was to what the new norm is, and still currently is in this present stage, with now the next stage of where we thought for a little while there was a bit of space to perhaps return to work, perhaps return to school. And all of a sudden it's gone back to the stage 1 sort of circumstances almost with this new second wave. So for me, how do I apply the new wave in my day-to-day tasks, and what does that look like for my environment? Is I still believe, and in my household we have 4 other people who reside in this house. So I've got 2 teenage boys, an adolescent daughter, and my husband. My husband will go to work, so he's one of these people who can still continue to attend the workplace and manage that without any discrepancies to the norm that was. Myself, I work from home, so being able to before the lockdown of children was I'd take my children to school, my daughter in particular, an hour drive for me, an hour back home. So that's fine. Once she's at school, I get back home and I'm back at work. So that's the structure for me. And then the teenage boys, unfortunately, their work has seized them. So therefore, they're currently looking for work. So a new normal again for that situation. So I guess, how does it affect us all? It does terribly in different management and different capacities. But I do have to say that mental health in all of the scheme of things is going to affect everybody individually. And what is really important is that people are speaking out and actually flagging that white flag and saying, or red flag or green flag, and saying, I need help. This is too much for me at the moment. I've got washing to do. I've got to wash the dishes in the sink. I've got to get to work at the same time online. The kids, need to have their lunches made. So it's really about communicating within your own home and delegating in some ways who can do what to help and support each other. Yeah.
Okay, that's great. So when you say that people wave flags, whether it's red, green, or who do they contact? Like, is there different places they can contact, or?
Yeah. Sorry about that. So where can they go? Well, there's definitely lots of external services. Immediately, the first point of contact will be the people in your home environment, if we're referring to the restrictions that you need to adjust to in your home. So it's about talking to mum or dad, if you're in that possibility of being able to do that, and the seniors that perhaps are in your home to support you in whatever capacity they can. But external services, then we do have allied health services that you can support or be supported by, depending on what the need is. Your GPs is another person that you can contact. There's certainly some coaches, counsellors, psychologists, depending on what the need is and to what level. There's a lot of neighbourhood houses still operating. There's community access points that you can connect to. It really just depends on what you are aware of that you have available within your local community that you can access as first point of contact, because it's going to be different for everybody's communities in their regions. But I know that Facebook is certainly an ideal way to engage with these sort of things as well. Yeah.
Thanks, Nikki, and certainly you have raised some very good points. And I do agree that I think your family and your friends should be your first point of contact. But if someone is actually facing any hardship with that as well, probably I think contact your local council and local neighborhood houses. So very good point raised. I might talk to Ravinder Kaur, who is actually the founder of Rehmat Sandhu Foundation, which is a foundation she started on the name of her son who left this world at a very young age. So welcome, Ravinder Antiji. I just want to introduce Ravinder Auntie during the great work she has done during this coronavirus timings as well. So she did a wonderful job of, she utilized her time doing a great stitching of, I think, nearly many hundreds of masks for many community organizations. And she also arranged some meditation sessions to cope up with the COVID-19 stress. So Antiji, I think Ravinderji, so maybe if you can tell us more about this, and please be comfortable if you want to speak in Punjabi as well.
Hello everyone. Hello Ranjeet, Nikki, Gurinderji. As for me, I know COVID is there, but I'm taking it very positively.
Yeah.
And in my opinion, I think that happiness is not about getting all you want. It is about enjoying all you have. So at this stage, when everyone, all of us, it's not just me or you or anyone, it's all of us in the same stage, in same position. So I feel that instead of being negative, if we are positive enough and we bring positivity and happiness around, I think that would be wonderful. So that's the reason. And I love solitude. I don't mind staying at home. And I'm into meditation myself. I do lots of art and stuff. So for me, this is all good. Like, I take it positively. And I've got hundreds of children, my son's friends, and I try being positive with them and bringing in positivity and happiness. And we thought, okay, let's do something good. And we found that there weren't enough masks, and we could organize some reusable stitched masks. And I'm not very good at stitching, and I was actually self-isolated because I had just come from India and I was at home, and I do not have any I did not have any sewing machine or anything. But when I asked, when we spoke on the phone, and we realized that we could do something. And then that's where all these children, they got me stuff, the cloth and the sewing machine and the thread and all that. And we started with it. And then there were others, my other friends, we collaboratively, we did lots of masks, and that's how my time was spent.
Yeah.
I loved every bit, like, yeah.
That's really great. And I want to tell everyone that she was actually on the news and on SBS channel because of the great work she did, which is fabulous. Because I think this is a great way of, not just utilizing your time, but also overcoming the mental stress, the isolation that is being caused by COVID-19. And this is unprecedentedly a very hard time for everyone. And this is a great motivation for people like everyone as well, I say. So I might ask another question to Ravinder and TG as well, just around this. So how do you think it actually helped in your, mental health? And like you said, that it makes you happy. You
Yeah.
think if you were not doing this, what you would have been doing?
See, as for me, we believe in sharing and caring. And our motto is loving. So like we like doing something which brings positivity and love around. So that's we thought that was the need at that time. And then apart from that, we organized some meditation classes on Zoom. And they were like the first session was with 22 people, and then again 22, and then there were more as well. And this course was basically a happiness course, and everyone enjoyed it. They weren't our community; they were from everywhere, and we had people from UK, we had people from India, we had people from Canada at that time. So we were all together, and we were doing that, and they were breathing exercises which helped us really well. And we felt very positive after that. And it is important to stay positive. I think we can't be negative and talking about coronavirus all the time. Like, it has to be something. Yeah. Whatever God has, it's part of it, and we have to accept it as it comes. And I'm sure it's going to go away one day, and we'll be all good and happy, and we'll be there where we were before.
Yeah, very, very well said. And in Sikh religion, I want to mention that we believe in staying in the hukam, which is the divine will of God. And this is certainly the divine will of God that is actually happening at this time. And we all need to face it, and we all need to be in this together and face it with positive attitude. I might pass it on to Ranjeet to continue this.
Yeah, so with Ravinder Benji, thank you for sharing that. That's really nice that you've mentioned some positivity there, especially with your meditation online with 22 people. I mean, that's amazing, absolutely amazing that you've had that. I wanted to ask you, so when you made the masks, did you have like an online course, or did you know how to make these masks? Did you have a team of you, or how did it work with the masks?
Not really. I'm not very good at stitching, but I YouTubed it. I went into Google and I tried doing it. The first one was a bit hard, but then we made, then I got used to. And then my other friends one of them, she runs a Rano boutique, and she's good at stitching. So we tried to follow her, and she made lots of them. And then even I got into it, like, once you know it, and then it gets easier. And we really went well after that. And there were others as well. And one of her friends, she lost her mom at that time. Oh. And the mom was in UK and she's here. But we got her into this. And she was happy. She was doing the mass, and she forgot about her mom and her grieving part, and which was very good. And she's really appreciated that. We got her into meditation, and she does meditation. Actually, she believes in Pana, Guru Nanak Dev Ji's, but still, like, at that time she needed someone, some support, and we were all there, and we got her into that activity where she loved it. She knew stitching, so that's how we really went on well. Yeah.
No, it's really good to keep active in this time, especially if you're alone at home. And to stay positive isn't always easy, especially if you've got no support. And finding ways to deal with like children's tantrums or understanding their emotions and people as well. So keeping occupied with virtual classes is absolutely amazing. But I think the seva you've done has been amazing. And we can see a picture here of where is this your studio where you do your sewing?
No, actually, this was just where I'm sitting now, So I made it into a.
You're going to start making masks, aren't you, for us now, aren't you? No, that's great. Thank you.
Yeah. So this is her house where she actually was stitching. So that's amazing work she did, sitting on this place and, stitching so many masks. So that was a wonderful job. So thank you so much for all this fabulous job.
No, I'm thankful to Guruji for giving us this opportunity and doing this seva. So we're really thankful.
Yeah. So I think when we do seva, it's a double motivation. It's like serving the community and also being positive in your own life as well, and it strengthens you from within. So that's a pillar of our religion as well as our faith as well. So that's very important. I think it does help us to pass on this hard time. So we're getting some good comments, and we've got a comment from Kiran, who is saying that who's appreciating the work that you're doing. She's saying, "Good on you, Ravinder ji. Great job you have done." So thanks, Kiran, for participating. And we have got a question for Nikki. So Nikki, you've got a question from Dipin, and she's asking if you have any tips for people who have anxiety and fear of this crisis.
Yeah, absolutely, and a great question, and one that I get very often. So certainly if we're referring to yourself first and foremost, because in order for you to be able to serve and support others, you need to be okay with where you're at in your mindset to begin with. And so anxiety is one of those things that can easily be dealt with, actually, with some of the wonderful things that Ravinder has been speaking about, which is meditation and being in a place where you can silence your mind, breathing, giving your time out from what is currently happening. Also, the concept of exposing yourself to the news as often as you may or may not. You only really need to get the updates and then you switch off. There is no need to continuously expose yourself to what is happening next, what's going on now, what have I missed, because all of that is actually a contributing factor to your anxiety, and it's not something that you want to will for. So anxiety is very well managed when you are able to find some great tips and strategies of how to do that. So we mentioned meditation as one of it as an option. Can be done with yourself, with your children, and with other members of the family if they choose to. If it's not their thing, that's okay. We don't force and we certainly don't push it through. You look for other ways. Drawing is another one. Artistic, and even if they're not artistic, just doing things in the garden, planting seeds, for example, and doing some wonderful gardening in the backyard or in a small pot, in a smaller scale. So gardening is great. Meditation is great. Art therapy is fantastic. So being able to draw stick figures even, you don't have to be a Picasso. You can simply just do some very simple stick figures and allow that stick figure to become another joint stick figure. And then before you know it, you've got a little pattern going on, which is like a wow factor for some children, depending on their ages as well. So also the language that's used around this coronavirus time, perhaps don't dampen it to say, oh my goodness, what's going on now? Especially, again, relating to what is being shared on the news, and the conversations that you have within your own home. So if there's young ears around, we always often say, have that adult conversation away from the younger children. And if they need clarification and so forth, they're very mindful, they will ask. And then when they are asking questions, I would strongly suggest don't give them the details, just straight to the facts and keep it simple. Hopefully that's answered her question.
Yeah, no, it has answered the question. Thank you so much for that. We've got another comment as well from Vasalia. And on a positive note, COVID-19 has taught us that we perhaps can master our ability to cope, focus on our emotional well-being, and renewed hope in revving the community spirit. So this is that's a positive note. For some people, positivity comes really easy, and for some people, it doesn't. And the uncertainty doesn't come easy. Like that's something that anxiety triggers.
That's
So
exactly
it's about
right.
how we cope, and so one question I would also like to ask you is, how safe do you think we are now? Because obviously there's a massive change in what's happened, and so how safe are we now?
It's a great question once again. For that, I would certainly ask adults just to have a look at the DHHS website, Department of Health and Services website, and just see the current updates, because it's different for every region and every community. What you want to be mindful of is what is active cases. So they've got confirmed cases and they've got the numbers, but you want to see what is active cases. And of course, that's the rise that you want to be careful of. When you ask how safe you are, it all depends on what it is that you're doing in order to make it as safe as you possibly can for yourself as an individual. So, doing all the things that we've all been shared and told to do. So the self-isolation and the social distancing and washing your hands and sanitizing and avoiding to touch your face where possible. And if you have, then, wash your hands after that. But we're not talking about to the extent where you're doing it vigorously all the time. So you've got to be extremely mindful. Education comes part of this, and that's really important, especially for younger children, because kids will be kids. They're going to want to go outside to the park if it's local to them, and they are going to want to perhaps play with some other children, and that's okay. We're not saying, no, don't do that, you can't do that, and go into panic mode. You would encourage that, but you want to keep the social distance factors in place. And of course, there's the masks and things as well, which is a personal choice for people too. So
Yeah.
Safety is a big thing, but I think education comes part of that, and also being very mindful of how you approach that safety mechanism for others to see and do.
Yeah, no, that's very good. I think one thing I've realized is by staying mentally and physically healthy has ensured my own safety as well. So I find that if I'm not mentally stable, then I'm gonna have a poor health, and that's not gonna make it good on my psyche. So I find that it's important to have balance of it all, really. So yeah. So Dipin Kaur's also mentioned those are great tips. Thank you. So thank you, Dipin, for your input here. And yes, and reacting around other people as well. So I also go and visit my nearly 90-year-old nan, and so when I do, she keeps quite distant from me even now, and that's really good because she's respecting the current situation. So we still keep our distance in the situation, but I still want to go and hug her, but I haven't been able to for 3 months. Or I've not been able to massage her feet because she's you need to stay away because you still go out shopping. And so the social distancing is still there, and it's good to respect each other as well. And so that's the measure that we take personally. Do you all take distance measures as well with your loved ones, or have you all relaxed? Benji?
Yes, I think with the second wave that has come in Victoria, especially in Australia, we have been getting double-figured cases every single day, and the panic has come back again. And we're getting those questions again, once which were going back, and now even my own daughter, she's asking again. It's the second time the school holidays have come, and the activities have stopped again, and there's hardly for us anything to plan what they can do and what they can't do. The birthday parties are getting cancelled, and that's simply impacting especially the kids. And even if we are asking kids to go anywhere, they're actually becoming more reluctant on that. They say, no, it's COVID. So I think the panic mode has actually enhanced for the children, especially. It's impacting them a lot. They are becoming more conscious on that. So that is something I think we are becoming more aware that is it something that gonna impact them for in the long run. So that new normal is actually making us anxious. So how long will that take? Whether it's gonna take months or a year, I think that's very that's something a surprise at this stage. We don't know. We can't reveal at this stage. So probably, Nikki, if you might have any tips to add on that, especially with the kids, what do you think? I know it's been something we've been dealing with, been doing art activities. We're trying to keep them busy, but as the time is passing on, it's looking like never-ending kind of thing.
Yeah, I think if I can say, and Vasilia kind of touched on this with one of the comments that came up, is that if we rewind what stage one has done for all of us during the first initial, thank you for the first initial stage in lockdown, is that it actually brought people together. It gave you the opportunity to slow down the pace of your life, your journey, your business in your working day, your extra curriculums that you had to do. So it gave that opportunity just to nurture and manifest and pause time and slow things right down so that the family could actually look at ways of connecting again if they didn't have that, perhaps communicating with each other, being able to actually be in each other's lives in the way they needed to. One of the things that you also mentioned, Gurinder, is that because you use the word panic and you use the word feeling anxious, and they're both negator words. So these are the type of concepts that we need to be able to be mindful of in order to change the language, change the way we shift the way we think about things from a negative aspect to an optimistic. I won't say positive, because positive is a lot of work and it takes a lot of Pollyanna to be positive all the time. But optimistic is certainly something we can all be. And, you know, if things don't work out the first time, well, that's okay. You can scrap that idea. And if kids don't, you know, want to do another art activity, that's okay too. If they choose to just sit and do nothing, then it's okay to just choose and sit and do nothing. Again, I have to reiterate, the language is really, really important behind the next transition. The support that you offer to your individual families is also going to be very important, especially to the seniors that perhaps live within your households, and what they can do around the house, or the very little they can do is still going to be a something. So it's altering the thinking in order to shift it from negative to optimism, and ensuring that, you know, as you mentioned, we don't know how long this bar is going to be stretched. So you've got to ensure that what is already nurtured from the very beginning, what worked well, harness on those things and do a little bit of those again until the stretch goes. And ensure that you're not doing too much in one day. Spread it out. You've got a whole 7 days to work through it, you know. And be mindful of that, you know, if you still have to work at home and the kids need to be occupied in some way, and finding that balance, well, that's again where you have those conversations. And as you mentioned, Gurinder, the kids are getting it. They are on top of what is, you know, they're understanding that, oh, it's COVID-19. You know, they get the fact that I can't do this because this virus, if I get it, I will be sick and I could infect the family. Therefore, I need to be mindful not to be doing anything that I shouldn't be doing to protect that. And that's what you're talking about, the protection of your unit and your family within your household. And of course, family members and the 5 that might actually come and visit as well. So we certainly don't want people to become hermits. We certainly don't want people to sort of, you know, get into that concept of panic mode, here it comes again. And we certainly don't want people to feel anxious. What ideally we want to do is continue to nurture what we once was given as a gift, where slowdown of time had happened, where you can harvest and look back at, you know, your own sustainability within your own homes. What can you do from a horticultural perspective? How can you actually stock up but not panic buy, as we talk about these days? And you know, make and create things that you can do back in the days, you know, in farmland, perhaps in our hometowns or countries, from places that perhaps Ravinder has lots of experience of as a child, perhaps.
No, that's wonderful tips and suggestions. I believe that we can actually practically use in our families, and I like the idea of using the appropriate language as well. I think that's very important and we need to keep in mind. So thanks, Nikki, for that. I might move on to Ravinder Kaur. And so Ravinder ji, maybe if you can tell us more about, you know, I know you have done a wonderful job with the masks and that work has already been done. Besides stitching mask, what other activities and meditation activities as well? So what else has been keeping you busy and strengthening at this point of time?
As for me, like, as Nikki said, language and thoughts. So I believe in thoughts, and I believe thoughts, they become a reality, and thoughts manifest. So whatever we think, it does work. So I think at this stage, we need to be role models for others and support them and do what is right. As Nikki said, to use the appropriate language and communicate well, and not to use the negativity. And that's what we've been doing together. And it's really working. And my message would be to stay at home if you feel unwell, and if you have any signs or symptoms, no matter how minor, please get tested. And practice physical distancing, good hand hygiene, as well use appropriate PPE when required. And I work in a hospital, and we do all that. And um, we've been with COVID patients as well at times, and still we've been okay with that positivity and smiling and talking to everyone. And one thing I must say is that we should ask each other how they are. Are you okay? Are you fine? That's really motivating, and that boosts up your morale, and you feel that there's someone with you to share or to support you. And I think this time is a time when we can support each other, take care of each other, and assure them that we are there for each other, and support them. And there's a very good example I have learned. I have a so-called daughter, and I called her and I asked her, how are you doing? And how's the little one doing? And she said, oh, in the beginning, he wasn't too happy. And but now he teaches us. He teaches us, no, we are not going out, Mom. It's not safe to go out. And then he comes back from somewhere, he tells them, oh, wash your hands now. You need to wash your hands. You just can't enter like that. Take your shoes off before you enter. So, like, it's not only the stress we are getting from COVID, but we are learning things as well. That's what I feel, that the children, if we are role model for them and we teach them what is right and what is good, and they do learn from us, and they are learning, and they're taking it very happily and very positively. It's just us. We have to be right enough and teach them the right things.
Oh, that's nice. Thank you so much for that positivity. With your meditation online, I'm intrigued to know. So you have quite a nice a volume of people coming on. So is that welcome to anyone? And are you still doing these sessions?
Yes, everyone was welcome with us, and we were doing with Art of Living. And we had a teacher from US, and he's been a long time teacher with Art of Living. So he was the main lead with us, and we would Zoom. And ever since he left us, we have a small group, and we do it from 9 to 10 every day now. So he's got us into this, and we do lots of breathing exercises, and we do yoga and pranayam, and we feel very motivated and happy. And I think I keep very happy throughout the day, and even at work. And I make everyone laugh. Like, everyone thinks, oh, like, I don't know, like people say when I walk in, like I bring positivity, and they're all smiling and happy, and they wait for me. So
we call that the beacon of light.
Yeah. Yeah. So we've got a comment here from Vasalia, and they've mentioned, as working for 22 years, I was able to reconnect with my 3 children. We started a cookbook whilst cooking together, played many board games, and found out that Monopoly is not my favorite. Gardening, children are very resilient. So this is amazing that they've got they started a cookbook, and it's family time. So, where everyone's at home together, reconnecting, getting that networking together, especially with children, is absolutely amazing. I mean, I've had that in my house as well. And I feel a lot of people have that as well. So I think it's a really positive thing. Another comment we've got is from Bhajanam Kaur. COVID has definitely made us stop and appreciate what we have and has allowed me to slow down, take a breath, and do things that I enjoy, like playing basketball, gardening, and cooking. I have found great mindfulness techniques and Kirtan on YouTube. Stay safe, everyone. Thank you so much, Benji, for this comment. It's a lot of positivity with the COVID, staying at home, being with family. I think it's made a massive impact for us as well. So thank you so much, Ravinder, for your input and how you have got a positive vibe, by the way. You're always smiling. So I just thought I might join in this meditation.
Yeah, I think that's very important. And I think everyone has got their own network and, set of activities they enjoy. So it's very important to use your networks in this particular time and try to, speak to your relatives who you might not have spoken for a long time. Just get to know how's everyone doing. Sometime when you speak at this particular time, you share that what is going common in everyone's lives, and and that's when you just get together with everyone. And same is with the local networks as well. I think it's time to speak to everyone, share your feelings, and even if regardless it's a positive or negative feelings, I think the idea is to come out and speak out, so that we know that where everyone is standing and where we can support each other. So that's very important. We've got another comment from one of our guests from India, in Delhi, and she's wishing hello in Punjabi, which is Sat Sri Akal, to all the beautiful ladies. Thank you, Kulvinderji. Thanks for your comment.
With Nikki, if I can ask you, so you have a website called Mind Ahead. Are you able to elaborate on this and talk about what it is that you do and what you offer?
Sure, not a problem. Thank you for asking. So Mind Ahead was established in 2015 or 2014, and it is very much about coaching and counselling people who need the support in changing their thinking and shifting their thinking, more so based on what it is that they'd like to shift it in, the areas of, be it work or family or relationships or finances. Sometimes, you kind of think, for example, you want to start a new job, especially now with COVID-19. People have lost their job and they think, well, how can I help people? What can I do? What are my strengths? And sometimes you don't actually know what your strengths are until you have a conversation and you go, well, actually, did you know that you've got strengths in this area? So it's having those very deep and meaningful conversations, nutting out the scales of what areas are important to you and how I can support you with that journey. For example, there was a gentleman I spoke to just last night, actually. He's a professional dentist from overseas in India, but unfortunately his documentations and visas are in the process of being looked at and responded to, and because of COVID they're at lockdown and he can't access the credentials that he can prove himself to be able to do his dentistry here in Australia. And so we had a conversation about, well, what else is your passions, or what is it that you like doing, or what else can you offer perhaps, and not in the same industry, but do perhaps a short sidestep just to get you some sort of income until the opportunities rise again, or even supporting people with applications. I've got a teaching background, so I'm happy to help people with their selection criteria. I know that language in a hard copy, for some people, they say what they think, and on paper it doesn't read well to an audience. So, if you need support with that sort of thing, I can do that. I do work with all ages, predominantly primary school, right up to 80 plus. I think the oldest member I've ever had was probably 80 plus, but that's just a small component of what I'm able to offer. So I do lots of other things, but you need more time for your program for me to go through all of that. But I will point this out, though. I am seeking for those that live in the Mitchellshire region, in particular, members from the Kaur community, women or male, it doesn't matter, females or males, to share their story and perhaps look at being a co-author for a book that I'm funding at the moment, and looking at getting further support funds for the opportunity to self-publish their own, because I am an author and a co-author as well. So my way of giving back to the community is giving somebody else that opportunity. And so that's something that I am looking for. So if you're interested in writing your chapter in a book, now's a chance to give me an email and we can go from there.
That's great. Thank you. Do you also, so with your sessions with your patients or colleagues, are they all via Facebook or Zoom? Is it daily?
So I refer to my people that I coach as clients, and we definitely can do one-on-one over Zoom at the moment due to COVID-19, over the phone or via email, because some people prefer not to do any of the full-on talking and rather do it via email, and that's okay. The challenge that sometimes I have is what they really want to say doesn't actually get said, but because I have done neuro-linguistic programming, as a practitioner, I can read between the lines, so I know exactly what they are trying to say, even though it's not formally written in their way. So that's the bonus of having the skill sets that I have, I suppose. But certainly, available on Skype, available on WhatsApp, available on Hangouts, available on Zoom, and available via the phone. And usually after 5 these days is the best time to have any coaching or counselling sessions on that one. What else can I tell you? I think that's it in a nutshell. Anything else, people? Just ask and you never know.
So people can find you on www.mindahead.com.au.
Yep, absolutely. They can find there, and all the information's on there as far as contact and fees and all that other stuff that goes with it.
That's great. Thank you so much for that. Also, I wanted to ask you on a going back to the mental health in the new normal.
Absolutely.
So another thing that we discuss here quite often is vaccines, and whether when the vaccine does come out, or if it does come out, what are your thoughts on this topic? Whether we fully understand what's in the vaccine, should we investigate what's in these vaccines before taking them? Like that. So what's your thoughts on this matter?
Look, I don't have any formal research or profession advice on this, but I can tell you this, and that is I do know of the professor at the moment who has been speaking on Channel 2 ABC and Channel 9, all sorts of networks, named Basso Apostopoulos, who's a Greek lady and a professor in the vaccines department. And she has basically confirmed that currently with the vaccinations, it mutates itself. Unfortunately, any viral symptoms, it's going to mutate itself. So what I understand is that with the mutation, they're looking at obviously trying to find different strands from different current medicines. So things like you might treat HIV with, you might treat tuberculosis with, you might treat inflammation with, so different strands of current medications, and they are testing all those different current medications with finding what may work well with the antivirus for the vaccine of what's currently we're all dealing with in regards to what can be an antivirus for COVID-19. So she's certainly a person that would be one to pick their brain as far as vaccines and what is the ideal thing to be administering at present. From my personal perspective, and it is a personal choice. However, I know that from a school perspective, you need to have your vaccinations before you enter school age. So that is a mandatory requirement now for education. So unless you, you're school ready, so whether you're in prep or pre-kinder, so grade 3-year-old, 4-year-old, or preps, 5-year-olds, you should have your vaccinations. It is Australian law requirement with children. With adults, if you've never been vaccinated and you feel that it is something that you should consider, well, think of those that perhaps take the flu vaccination and why you do that. It would be very similar to that sort of thing, I guess, and it is a good protection to have with regards to all the viruses that are out there at the moment. And remembering that it does mutate. So even if you did get the flu vaccinations, there's a guarantee you become unwell before it can fix into your system and do what it has to do. It is just the nature of what it does for our bodies, and everybody's going to be different. Everyone's going to react differently because we're not the same, and we all have different streams of underlying health issues that might be effect to that vaccination. So it is a personal preference, but for me, and my personal opinion is I wouldn't second guess it. The medication is there based on a lot of trial errors and what has worked and proven to work. So why put yourself at that risk if you know there is something that could support you? And that's
Thanks,
my
Nikki.
yeah.
All right. Now, just with your book, you can count me as a co-author. So I'm in for that. So that will be a wonderful opportunity, Nikki. And thanks for sharing.
Not a problem. I'm more than happy, and there's more to share as time comes. I can tell you, just got to ask the questions, and the mind will give you the answer in whatever capacity it can, without a doubt.
Yeah.
I'm very much into supporting members of our community. I think that's a very big passion of mine. It's my calling, if you like. And so I aim to do whatever I can for others as best as I can. Yeah.
Sure. Yep. Thanks for that. And just while we were talking about vaccines, I just want to ask you, at what stage one should be seeking help of a professional in the circumstances that's been going on?
Okay, so in regards to COVID, look, if you're showing any symptoms of any COVID, and I know that Ranjeet spoke about this earlier, you should go get tested, because you just don't know if it's just a common cold, if it's just a normal flu-like symptom, or if it is COVID-19. So I think that's the first and foremost, that if you're feeling a little bit unwell, even if you've got like a little bit of a headache where you wouldn't normally have headaches, you know, these are all new possible circumstances. Now, you're not going to say, I've got a runny nose, I've got a headache, I've got a sore throat, I've got COVID. No. All you're doing is just going to get checked out and making sure that you're ruling out that you don't have the virus, yeah? It's very possible you just have one of those flus. I mean, it's winter. You could easily become unwell during this season. So I think the earlier you feel that you're not feeling well, then you should probably just go to your GP. Doesn't hurt to go get looked at, have that conversation. If you're really concerned, definitely go and get tested, because that's what the health authorities are telling us anyway. Any mild symptoms, go get checked out for the just in case.
Indeed. So just in terms of mental health, when do you think one should seek help as well?
Okay. Yes. No, well, mental health, yeah, no worries. So mental health now, that's a whole different whole different area, because with mental health, if you're noticing that people in their behavior are slightly differing from what they normally would be, so if someone's usually very happy and chirpy and outgoing, and usually a conversationalist, and then all of a sudden there's a flip side perhaps, and if you've noticed they've deteriorated by having conversations, or they prefer to stay in their room, or you notice that things are dark around their environment, so closing the blinds down, not answering their phone calls, not replying to your messages, then you know that something is not right based on what you know of that person, that their normal characteristic value that they would have and hold as a person and their personality. That's when you definitely can reach out to them. Now, it's a very delicate matter, because if they're unwell and they don't know that they're unwell, what you can do is simply say, I'm really concerned about you, I care for you, and I really want to know what's going on to try and help you. So you will not have the answers. You're not there to have the answers and say, you're sick, go see a doctor. No, what you're suggesting is that I care for you enough that I want to be there for you and to help you, and whatever that might look like, however best you can. And the challenge, of course, is now with COVID-19, a phone call and tapping into somebody and having that access is still a great step. And even if it means one phone call once a day, just to say, hey, how you going? How are things? At least they're not thinking of anything that could be detrimental. And especially if you start thinking that they might be suicidal, and that's another discussion altogether. So I do wear the hat of the Mitchell Suicide Prevention Network as the chairperson, and so that is a whole different conversation, but I can say this with confidence: it's okay to ask what's going on through your mind. Would you like to talk about it? Is there something I can do to help you? Asking, are you okay, is too black and white of a question, and you will get a yes, I'm fine, but really they're not. So you definitely need to have those more open, what we call open-ended questions, to engage a little bit more conversation from the other person, and then guide them and support them as best as you can.
Yep. Thanks, Nikki. And I think as we said in the beginning as well, that we do need to speak to our family members and friends as an initial point of contact. But if you find differences, you well said that we need to then see what else can be done, and we need to approach. That's really great. So I think we are moving towards the end of our show today, and this was a great and a very healthy discussion. Thanks everyone who has been commenting and asking and supporting this discussion as well. So it's really great when we get people engaged. That's what we want. Actually, we are doing this for the community, and it's really great to see that engagement coming up as well. So, Ravinderji, would you like to say anything before we just end this show? So, any closing comments, any tips, or any experience you would like to share with us today?
Nikki has well said everything, and I've taken more tips off her, and I think it was a great show. And as for me, I would say that we should start our day with gratitude. And just be positive, and see the other person's strengths and start from there. We've all got strengths actually, and better to talk of their strengths rather than the weaknesses, and just boost them up. And I think this will go one day. It's not going to stay, and it's part of us. And in fact, it's taught us to be united. And it's taught us that time is valuable and life is valuable, and we should love each other and give more time to each other rather than just working all the time and being out of materialism. So, yeah, thank you.
Thank you so much. That's that's what Nikki said before as well. We need to look at the language, and you have given us so much beautiful words: gratitude, loving, united. I think these are the words that we're gonna keep us the inner strength that we need at this particular time. Nikki, any closing comments from you? Any other tips that you would like to share before we let you go?
First of all, thank you, ladies. That's okay. Thank you for this wonderful opportunity. It was always good to speak about very valued and important topics that everybody is in this all together. We know that. We're all going to be challenged at different times of our lives. It's about how you manage that in your mindset and the way that you think about that, which Ravinder had spoke about earlier tonight, and how you can shift that thinking from negative to optimistic, how you can see the light. There is always light. Don't go to the darkness, to the light, and be guided by what you truly believe you can do, because everybody can do something, even if it's this little bit.
Thank you so much, ladies. I've learned so much as well with this, being positive, gratitude, and I hope others have learned as well that it's very simple to have this, and you can reach out if you have any issues or you see any symptoms within the family members or friends. You can definitely reach out, and where you can go as well. We will put links below as well. Otherwise, I've had a great show. I could keep talking about this topic.
That's great. Yeah. So thanks, Nikki. Thanks, Ravinderji. It was really great to have you on this show and share your experiences, and learned so much myself today. I think we already have a great support, a great network amongst ourselves. So at least we are there for each other. So that's super. That's amazing. And thanks to wonderful listeners as well. So thank you, Nikki, and thanks, Ravinderji. Thank you for your time today. Sat Sri Akal. All right. Thanks. Oh, that was great. What do you think?
It was positive. I could have carried on talking about, what else we could do and issues that, that actually occur in those last 3 months, and how we've dealt with that in strategies at home as well. But, that could be for another time. But this was great. Thank you. Oh, yeah.
That's right. Yeah. And I think this particular show, I think that was also an invention of this time as well, how we can utilize this time. That's also something positive, that we are coming up with these, opportunities, networking from Australia to UK, and, bringing people from so many other countries as well, and talking about different topics and building this network. So this is really amazing. I think this is also a positive way of using your time and coming up with something positive.
Yeah, definitely. I wouldn't have done this before, but I'm definitely on board with this now. I think this Zoom and going online is really helping other people, and the motivation that we get from Sangat, like, the comments and the feedback. Thank you so much. Keep sending them in. We need them so we can continue on with more topics. And if you've got any suggestions with topics as well, please send us an email to hello@thekaurshow.com. So feedback, comments, suggestions, anything you like, please send them through. Our website also is available for you to see our previous shows as well. And this is great. If you've missed out on any of them, you can also go back onto our website to see the previous shows.
Yes, thank you very much again, everyone. And next week we'll bring another new topic and we will have our new guests. And if you have any topics in mind that you would like to listen from us, any good or bad feedback, how we can improve as well, please feel free and do share that feedback on the email that Ranjeet Penji just shared with you. So Penji, any last comments from you before we finish that off today?
Until next week.
You got any tips? Yeah. All right. So thank you, everyone. We'll see you next week at the same time, 7 p.m. In Australia and 10 a.m. Is it 10 or 10:30?
10 a.m. in the UK.
10 a.m. in UK. And we will share a flyer anyways on our Facebook and other social media pages. So thank you, everyone. Have a good night. Have a wonderful day wherever you are. Thank you. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.